Thank you for joining us on AHA Awareness Day 2025. My name is Lewis Jackson, and I'll be reviewing our studies that revealed insights from patients with warm autoimmune hemolytic anemia, their caregivers, and healthcare providers based on assessments of digital conversations. Here's a brief overview of our disclosures. Now, to get started with the topic of the day, what exactly is WAHA? WAHA is a rare red blood cell disease that occurs when the destruction of red blood cells is accelerated. The leftover parts of these destroyed red blood cells are then released into the bloodstream and tissues, which causes a wide variety of symptoms. WAHA affects 1 to 3 per 100,000 people every year. And finally, many factors of living with WAHA impact mental health due to fears about symptoms returning, treatment uncertainty, or worsening of symptoms. Since there are currently no FDA or EMA approved therapies for WAHA, there is a need for effective therapies approved for the disease that have proven safety profiles and that can also maintain immune function. Potentially, this could reduce the need for surgical removal of the spleen or repeated blood transfusions in patients with WAHA, both of which pose a substantial burden to patients and their caregivers. So, AI, social listening, big data, machine learning, these are all phrases that you've probably heard in recent years. These techniques are increasingly being used in research to better understand the daily lived experience of patients through assessment of their online digital conversations. The information that is sourced using these methods can provide an unbiased, unprompted look into patient perceptions of their disease and also available treatment options. These insights can then be leveraged to help highlight the overall disease burden and related unmet needs. And so, with this in mind, the objective of our study was to conduct a novel sentiment analysis of digital conversations among patients with WAHA, also including their caregivers and HCPs, in order to better understand the real-world experience and impact of living with WAHA. And the research that I'll be sharing today was previously presented in poster format at the 2024 meeting of the American Society of Hematology. We assessed digital public domain conversations among adults who engaged in online conversations about WAHA over a 24-month period using artificial intelligence-powered algorithms and per the criteria listed here. So these were English conversations coming from US IP addresses. This AI-powered methodology extracted and sorted the content from contributors who self-identified as having WAHA, putting them into different categories and themes. Overall, two large datasets were organized for these studies, one for patients and caregivers combined, and another for a smaller number of conversations coming from healthcare providers. Each conversation was categorized as positive, negative, or neutral in tone toward the disease via sentiment analysis, and then these were further broken down by the most frequent themes within each sentiment category. We also captured patient mindsets and categorized those as well. These are the 4 stages we identified that patients experienced across their WAHA journey. So for a subset of conversations, patients indicated that they were currently within one of these 4 stages, and they included pre-diagnosis. So this was early on in the process when patients were being evaluated. They exhibited symptoms, and so there was suspicion of WAHA, but it wasn't yet confirmed. We saw the diagnosis phase of the journey. So this was after that initial medical evaluation when patients finally had a confirmed diagnosis of WAHA. There was the treatment phase, and so this was the stage of the journey where there was a clear medical plan that was established for the patients. And then finally, we saw treatment adjustment. And so this is after that initial treatment. This could be a time when there was a need for slight modifications to the treatment plan after that initial treatment was received by the patients. So before I get into the results discussion, this study has several limitations. As with all social listening analyses of this kind, Conversations were not necessarily associated with a patient diagnosed with WAHA, as this could not be verified, and user anonymity across most digital platforms further limits identification of demographic characteristics. Additionally, the findings from this study are not generalizable to patients with WAHA who do not partake in discussions on digital platforms. However, approximately 95% of American adults regularly use the internet, and the vast majority use social media. So a large proportion of patients with WAHA in the US could likely be captured through this analysis. Finally, only digital conversations that were conducted in English were analyzed, and so therefore the findings cannot be generalized to those who speak other languages. Further analyses would be needed in order to characterize those conversations. As shown here, when patients discussed their condition online, almost 8 out of 10 conversations took place on message boards and topical sites such as Waha Warriors, No Rare, Patients Like Me, CarePlace, and others. Of all conversations, only 6% occurred on social networks. In total, 22,309 conversations related to Waha were identified. And as a note, throughout the discussion, all in totals reported represent the number of WAHA-related conversations identified, and so these were not necessarily representative of individual patients with WAHA, but rather number of conversations. Here you can see an overall breakdown of the key sentiment drivers and themes drawn from the conversations. It's worth noting that these were not pre-specified. The AI algorithms took the overall body of conversations and characterized them into these themes based on the topics that were most frequently discussed by the patients. As you can see here, the most common negative sentiment theme identified was a lack of treatment success. For neutral drivers, and really this neutrality was representative or reflective of patients coming online to provide information or patients coming online to seek information. And so for neutral, the focus was also on treatment or therapy. Finally, as clearly indicated on the right, you can see that positive drivers were rarely noted. And so for all of those themes, they were representative of less than 5% of the overall body of conversations. When we look at the breakdown of sentiments by stage of the overall WAHA journey, from the patient perspective, you can see that negative sentiment increased at later stages, that is, the treatment and treatment adjustment stages. As discussed on the prior slide, some of these negative drivers were due to the increased difficulty in day-to-day tasks and worsened quality of life, as well as the symptoms and uncomfortable physical experiences that patients deal with. Neutral sentiment was higher in the beginning and lower in the later stages, and so this was possibly driven by a lack of general information about WAHA and accessible resources or recommendations toward it, and also the full process of getting diagnosed with WAHA through assessing of health symptoms and healthcare provider appointments. As noted previously, positive sentiment was rare. And when you look here by journey, you can see that positive sentiment was only expressed during the treatment stage of the journey. Okay, so now I'd like to shift gears towards the healthcare provider sentiments that were expressed about WAHA. So of the 2,847 posts that made up the healthcare provider dataset, 1,020 were from those in primary care, and 1,827 were from specialists such as hematologists, oncologists, immunologists, and rheumatologists. Of these, comments were mostly neutral in tone, as indicated by the 66% shown here. Treatment success and patient quality of life were the most frequent drivers of positive sentiment, while treatment not working, that is, the lack of efficacy, and patient resistance or hesitancy were the key drivers of negative sentiment. Okay, so now shifting gears back to the patient and caregiver dataset. So of the overall pool of conversations, we further distilled this down into 11,093 conversations that included some sort of characterizable mindset. And these mindsets were important to us because they helped us show the impact of WAHA on the patient's mental health. As you can see here, struggling was a very dominant mindset that was expressed by these patients at 36%, followed by uncertain at 29%. And you can see an example quote here, "The anxiety and fear of the unknown wrapped around this has been overwhelming." Next, we can see pessimistic at 24%. And one example quote, "I don't think I will ever feel well again." Finally, it's worth noting that hopeful was the least mentioned mindset at 11%. Looking at mindsets by stages of the treatment journey, mindsets were generally consistent throughout the stages, with uncertain persisting as the dominant mindset followed by pessimistic. Patients and caregivers felt slightly more hopeful during the pre-diagnosis and treatment phases than during the diagnosis and treatment adjustment phases. In conclusion, capturing the patient voice in digital public domain conversations revealed a high degree of negativity and neutrality among patients with WAHA. We also saw this with their caregivers and healthcare providers. This study leveraged a novel approach to explore the patient perspective in terms of sentiment, mindsets, and common topics of interest in self-identified WAHA patients. Digital public domain conversations revealed concerns related to side effects and a lack of treatment efficacy, while also highlighting the importance of healthcare provider support and involvement in implementing a successful treatment plan. Overall, the artificial intelligence-powered methodology uncovered patient sentiments and themes in an unprompted and unbiased fashion, providing candid insights that could be leveraged in the implementation of more patient-centric approaches to care. We hope you found this new study approach as insightful and meaningful as we did. To close, we would like to thank the WAHA Warriors for inviting us to talk to you on AHA Awareness Day, as well as the people with WAHA, their care partners, and the healthcare providers who contributed to this research. Thank you for your attention.